Hi, good evening, everyone. Welcome to today's talks organized by 365 Cancer Prevention Society and Icon Cancer Center. I'm Daphne, your host for tonight. So for tonight's session, we have a testimony from a caregiver, Jessie Chew. She will share with us her son's cancer fighting journey and her experience taking care of him. After her testimony, we will have our main speaker for tonight, Dr. Ang Lei Lei, pediatric hematologist oncologist. She will be sharing with us on the topic of childhood cancers, how to identify symptoms for early intervention, and what are some of the successful treatments of childhood cancers. We will also be having a Q&A session at the end of the talk, so do put down any questions that you may have in the comment section. Tonight's talk is co-organized by Icon Cancer Center, so do remember to like and share both our Facebook pages and our Instagram pages, and also invite your friends and family to tune in to tonight's talk as well. So to start off, let us invite Jessie Chew to share with us her testimony. Jessie will be giving her sharing in Mandarin, and I will just give a short, brief summary in English after her testimony. So now I'll pass on the time to Jessie.
嗨，你好，
Hello
主持人。
Jessie，晚上好。Hello。
你好，大
现在
家好。
就要把时间交给你。
好的，谢谢。我是杰西秋，凯文是我的小儿子，他在28个月大的时被诊断得了急性淋巴性细胞性白血病 ALL。凯文在发病前胃口显得不好，整个人虚弱无力，脸色苍白，而且后脑和颈项上的淋巴细胞一个个的浮起。虽然如此，我们并没有马上就医，因为诊疗所的医生认为是伤风感冒所引起的症状，后来又猜疑是骨痛、淤血热症。还没等检验报告出来，凯文就发病了，便马上送医院治疗。在医院里，经医生抽取骨髓并详细的检查，才证实患上血癌，癌症也因扩散到脑部。凯文的白血病使到全家人忧心忡忡，不知所措。无论如何，我们必须听从医生的建议做化疗，因为只有化疗的药物才能把病情控制下来。整个化疗的过程，药物的副作用产生，使到凯文的性情转变，不时的发脾气。我看得很心疼，照顾得很辛苦。最令我担心的是，在化疗中，凯文的癌症复发，医生说必须换骨髓，我们就从家里的血源里面寻找适合他的骨髓。后来发现姐姐的骨髓最适合，但是在换骨髓的过程中，凯文突然进入危机状态，不省人事。我们当时的心情很害怕，还好凯文的后来的状况稳定下来，后来就渐渐的康复起来。在当时这一切突如其来的事件的发生时，我们也不知道如何是好。不过因着每一天我都在听广播电台的节目，在一项节目中我认识了365防癌教育协会。在协会里，我开始参加这个健康讲座，学到不少防癌抗癌的知识。之后我们的生活饮食习惯都改变了，吃得健康又有营养，这可以帮助提升凯文的免疫力来抗癌。在医院期间，协会的义工也来探访和慰问我们，感觉很温馨和感动。在凯文的治疗过程中，经济的缺乏是难免的，365防癌教育协会也在经济上补助我们的需要。在抗癌的路上虽然很艰难和困苦，但是有365防癌教育学会的帮助和关怀，我心怀感恩他们的付出，这使我立下心志，也想出一份力量来报答协会给我的恩惠。于是我加入了义工团队，一起探访关怀同病相怜的病友。同时我这里也想鼓励那些正在面对小孩患癌的父母，我感同身受，了解你现在的心情。为了让孩子勇敢的面对化疗和电疗，我们应该保持乐观的心态，和孩子一起抗癌。以上是我跟大家分享我孩子患癌的过程。接下来的时间，我把时间交给主持人，谢谢。
谢谢 Jessie，谢谢你的分享。Okay, I will just give a short summary in English of what she said. So Jessie's younger son, Kaiwen, was diagnosed with leukemia when he was 28 months old. Upon the diagnosis, the family was very worried and didn't know what to do. And afterwards, they followed the doctor for chemotherapy and for the treatment. Throughout the course of chemotherapy, the side effects of the drug was caused Kaiwen's temperament to change, and he lost his temper from time to time. At one point during the chemotherapy, Kaiwen's cancer relapsed, and the doctor said that his bone marrow must be replaced. So thankfully, they found that Jessie's sister's bone marrow was the most suitable. But in the process of changing bone marrow, Kaiwen suddenly entered a state of unconsciousness. But fortunately, Kaiwen's condition began to stabilize, and he gradually recovered. So Jessie and the family had a hard time taking care of Kaiwen, and because it was so sudden, they didn't know what to do. And she happened to know about 365 CPS during one of the radio broadcasts, and she began to participate in the health talks organized by 365 CPS. And she learned more about cancer prevention as well as healthy eating habits. She also mentioned that 365 CPS staff and volunteers visited them at the hospital to show care and concern, and also provided the family with financial support to help them with their basic necessities. So towards the end of her testimony, Jessie also thanked 365 CPS, and because of the support that she received, she decided to give back and join 365 CPS as a volunteer to support other cancer fighters and their families. She would also like to encourage parents who have children battling with cancer to stay optimistic and fight better with their children. So we thank Jessie for her sharing, and we hope that her testimony will be encouraging to other parents out there who have children battling with cancer. And if you know of anyone who are battling with cancer and require help and support, do reach out to us, and we will do our best to support them in any ways that we can. So next, for the next portion, we will have our tonight, Dr. Ang Lele. Dr. Ang is a pediatrician and a pediatric hematologist oncologist with more than 20 years experience in clinical practice. So Dr. Ang has also served as a clinical tutor at the National University of Singapore, adjunct assistant professor at Duke NUS Graduate Medical School, and also as a guest lecturer of advanced nursing at Ngee Ann Polytechnic. Tonight, she will be sharing with us on the topic of childhood cancers, how to identify symptoms for early intervention, and what are some of the successful treatments of childhood cancers. To Dr. Ang.
Thank you, Daphne. And Cici, thank you to Jessie for sharing her long struggle as well as positive parts about Kaiwen. And congratulations to Kaiwen for being a cancer survivor and doing well. So today, I would like to thank everybody for joining us at night on your Saturday night to learn a little bit more about childhood cancer. So just give me a few minutes to share my screen. I hope you can see my screen now. So the topic I was asked to do tonight is childhood cancers, what you should know. A little bit about what a pediatric hematologist, oncologist like myself and several of my friends in Singapore do. So what we do is that we take care of children as well as infants, teenagers, and young adults up to the age of 21 years with various blood problems like bleeding, low platelet count, anemia, thalassemia, or bleeding problems like hemophilia, as well as cancer or oncology. So cancer in children are examples like leukemia, which is what Kaiwen had, lymphoma, brain tumors, osteosarcoma, neuroblastoma, and various type of cancers in children. We go through extensive training, as you can see, at least 14 years after completing A-levels. We initially do training in general pediatrics, so just various childhood disease and illness problems. And then we focus a little bit more after that, at least 3 years, to train on how to diagnose, care for, and treat children with different blood as well as cancer illnesses. The topics that I'm going to cover tonight is going to be to give you a little overview of cancer in children, teenagers, as well as young adults, the impact of a cancer diagnosis that might have on the child, the parents, the family, the siblings, as well as relatives. So similar to what Jessie would have gone through. A few common cancers, so mainly 2 different cancers that I'll share briefly about, some of the treatments and side effects that the children may experience for their cancer treatment, and then summarize at the end for you. So first, overview of cancer in children, teenagers, as well as young adults. What causes cancer in children? Is cancer in children different from adults? Because I'm sure that you have met at least one friend or a passerby in the community that have been diagnosed with cancer. The types of cancer in children, incidence and survival of cancer in children. And you will learn later that it's quite different from cancer in adults. What causes childhood cancer? Basically, we actually do not know the exact cause of cancer in children. In adults, you know that we have had different lifestyle choices and environmental risk exposures that may contribute to different cancers in adults. So for example, if a person was diagnosed with lung cancer, he or she may have been smoking for about 10 packs a day for the past 20 to 40 years for him to have developed cancer. But children are very young, and all these take many years to influence a cancer risk. So lifestyle choice and environmental risk factors don't really play a role in developing cancer in children. There is also no link of cancer with handphone use. There have been studies that have looked at that point actually. In terms of inherited cancer or cancer that you can be passed down from your parents or siblings, it is actually quite rare. So less than 2% of cancer in children is considered to have been an inherited type of cancer. Children are very innocent in terms of involvement in development of their cancer. Okay, so they are, because of this reason, we have to do our best to help children who have been diagnosed with cancer to overcome this. Cancer in adults is very different from cancer in children. In children, it is more sudden, it's quite fast, so the symptoms will be very similar to a typical illness that kind of persists and continues on, and that kind of alerts the parent to bring their child to their general practitioner or a pediatrician nearby, and the doctor then queries whether there should be more investigations that need to be done. The cancer in children actually arise from very early or primitive cells that are growing, as well as they are quite mobile, so they transform into various organs. They are biologically more aggressive. Because of that, actually, the treatment that we give to the children with cancer, the cancer responds much better. And you will be surprised and amazed that children tolerate treatments much better than adults. And because of that, the cure rates for cancer in children are much, much higher than adults. And as Jessie shared, we have many, many survivors, and these survivors of childhood cancer have many years of life ahead of them. Okay, so the types of cancer in children are not the same type of cancer as adults. So in adults, you will probably have met somebody who either had a prostate cancer, a breast cancer, or colon cancer. Whereas in children, the type of cancers are very different. So leukemia, similar to what Kaiwan had, is the #1 most common type of cancer in children. And the second most common type of cancer in children is in the brain and central nervous system. And then you have various other solid tumors or solid cancers, depending on the location of the cancer. So if you have it in the kidney, the cancer type might be something called a Wilms tumor. If you have it in the bone, it might be called osteosarcoma. So there are various different types of solid tumors in children after leukemia and brain tumors. So this is kind of a pie-like chart that shares about different types of cancer in both boys and girls all over the world. This is from the World Health Organization, and the information is available to all of us for free on the internet, and you can search. So on the yellow part of the pie chart, you can see leukemia is the most common, making up close to 30%. And then you have the pink pie chart part. It says BNS, which stands for brain and nervous system tumors, which is the second most common type of cancer in children. So all over the world, every year, there are about 280,000 children who are diagnosed with cancer. So in children, by this, we're talking about from birth to the age of 19 years. If you take a very close look at Singapore numbers, okay, our population is close to 6 million. If you look at the number of children who were diagnosed with cancer in the year 2020 for Singapore between the ages of 0 to 19, we have about 184 children who were diagnosed with cancer last year. This is based on the World Health Organization data. So if you have 280,000 children in the world, it is still considered quite rare compared to the adult cancers. And I know that many and all of the parents of children that I care for don't agree, but compared to other diseases, 184 children being diagnosed with cancer is not a lot, but not to me and not to the parents of our children. If you wanted a comparison at what about the cancers in adults in Singapore last year, so up to the age of 74 years, there are a total number of cancers, 23,632 who were diagnosed with cancer. So majority are going to be adults. So you can see breast is going to be the most common in women. In men, it's going to be prostate, followed by colon. So this is adult numbers for Singapore. It's quite representative of other countries for the adults as well. In terms of the overall prognosis or survival or cure rate for children with cancer, we can cure up to 75% of all children who are diagnosed with cancer. Okay, this is actually going to be more in developed countries like in Singapore and Australia, so not so similar of a number in our neighboring countries which are developing. What about the impact of cancer diagnosis? And I think that Jessie probably can share a great deal of what she had gone through with Kai Wan. The impact of cancer on a child is profound and it's devastating on the child as well as everybody in the family. We all know and we can understand and see what kind of impact it will have on the child as well as the parents. But we tend to forget what about the healthy siblings. Okay, the well siblings are usually the forgotten ones. So I also want to make sure that the healthy siblings are not forgotten when the other child has been diagnosed with cancer. Then you wonder, how will we get through this when you have a child who is diagnosed with cancer in your family? The first and the most important thing to remember is that you are not alone. Okay? No one is alone when the child is diagnosed with cancer. Coping with the cancer diagnosis and treatment is painful. Many of my families, the parents can tell me exactly the location, the time, what was happening when I had to share the diagnosis of cancer to them. Even though it may have been 10 years ago, they remember the exact time point and what pain they went through when they heard the diagnosis of cancer for their child. So, but remember that you are not alone. Also remember that majority of children are going to survive this disease. It is also important to ask for help from community, from the school. The schools in Singapore are extremely supportive and understanding. Don't be shy. Ask support from family whenever you need it. They are always available. Also, don't forget to celebrate each day. So whenever you have a good day, always celebrate that day. Remember to spend a dedicated personal time alone with the healthy sibling. If you have more than one child in the family, don't neglect the healthy sibling of that child who has cancer. As Jessie shared, remain positive. And many children, especially teenagers, will tell you, keep the hope. So keep the hope alive, okay? So next one that I wanted to talk about is common cancers. Because there are so many different types of cancer in children and they are very different from adults, I will only talk about two main common cancers. So the first one is acute lymphoblastic leukemia. It's commonly called ALL, and it is the most common type of cancer in children. And it's about 30% or 1/3 of children are going to be diagnosed with ALL if they have a cancer. And it's most common between the ages of 4 to 5 years. But you can have ALL in a very young infant like Kaiwan, or you can also have it in an older teenager, 18 or 19 or 20-year-old. There are different types, mainly 3, depending on the type of cell of the leukemia. Cure rates in Singapore, the most common standard risk ALL leukemia is up to 98% chance for cure. I think we can't ask for anything better than that. This occurs when the bone marrow cell develops some sort of an error in its DNA, and the cell doesn't know when to stop growing and when to stop dividing, and it just goes out of control. But we don't know the exact cause why this event happens. Some of the common symptoms and signs, because it is called acute, is very sudden and fast. They might have fever, but it's not a usual fever. It's more persistent fever that doesn't go away. The child may look pale because some of the blood cells, like the red blood cell, is not going to produce in normal amount. Because they are pale, they may have fatigue. There's another type of blood cell that is affected called platelets. When the platelets are low, your child may have bruises or petechiae. Sometimes you might have bleeding gums. Okay, you may also have swelling glands on lymph nodes, either on the neck or under the arm or above the collarbone. The child may have some limping or refusing to walk. Okay, it's not just one event, but it's persistent limping and refusing to walk. And sometimes the belly may be very, very big, and when you press on the liver area or the spleen, it might be enlarged. It's a combination of these symptoms and a persistent of these symptoms, and something inside mom or dad tells you that something is wrong with my child. I need to see the pediatrician or the GP. That listen to that voice and bring the child to your doctor so that we can investigate further. And the second most common type of cancer is brain or nervous system cancer. And there's also many, many different types. As you can see on the screen, they can be called astrocytoma, medulloblastoma, brainstem glioma. The way that the child presents is going to depend on the location of the tumor. In the next slide, I'll share with you what I mean by that. And surgery is one of the most important type of treatments available and necessary for brain and nervous system cancers. Depending on the type of brain tumor or the brain cancer, the cure rates can reach up to 80%. So when I talk about the symptoms and signs that are going to vary, it's because different parts of the brain control different functions. So you can see in the front part on the diagram on the screen, the yellow part in the front controls intelligence and personality. And then in the middle, the pink part controls the touch. In the back part, the yellow part controls the sight. So if you have a tumor growing in the front yellow part, you may have a child who have personality changes, Okay, if you have it in the touch part, maybe their sensation and the touch is different. If you have it in the back part where the sight control or the vision control center is, maybe they may have frequent falling because they can't see, or they may be holding their phone or their iPad in different angle because they can't see from a certain angle because the tumor is located in that area and the vision is affected. Okay, so this is a picture kind of to give you a sign to easier for remembering about symptoms of brain tumor. I want to tell you that it is not just one episode of vomiting, okay? Brain tumors and cancers in children is still rare, but it is more a combination of these symptoms and the persistence and gradual worsening that is going to alert you and make you worry whether should you see your GP or pediatrician or the pediatric hematologist or oncologist, depending on what's going on, okay? So some of the symptoms may be vomiting, especially early morning vomiting because of the pressure in the brain. They may have mood swings depending on the location of the tumor. They may have hearing problems, headaches. A lot of our teenagers and even the kids who are preparing for PSLE, they will complain of headaches. It's not, those are normal headaches, maybe stress headaches or lack of sleep headache, but it is headache that is persistent for many, many days and months that may be combined with vomiting, that may be combined with vision problems, speech problems, okay? So it's not one symptom or complaint, but it's a combination. And something inside you as a parent tells you that something is not right with my child. What about treatments and side effects? So there are different forms of treatment, and in the very beginning, we have the help of the surgeons. So surgery was an integral part of treatment for cancer. Then we were made aware of radiation therapy as a form of treatment for cancer. And of course, chemotherapy, which are medications that are given either by oral, taking by mouth, injection into the skin or injection into the arm, injection through the vein or injection through the spine. So various ways that chemotherapy medications can be given. And you heard about Kai-Wen. So stem cell transplant or bone marrow transplant is also a form of treatment. It can be either autologous, where you get the stem cells that are saved from the child themselves and then given chemotherapy and then reinfused or transfused back. That is their own stem cells. And then allogenic. So like Kai-Wen, his sibling was a healthy match donor. So it is a bone marrow or stem cell donor from someone else rather than the child themselves, can be a form of treatment, especially in children who have had leukemia and the leukemia came back, or it's a high-risk leukemia. Some of the children may need allogenic bone marrow transplant. Some of the newer treatments, biological treatments that you may have heard about, especially in adults, it's immunotherapy. You have also heard about CAR T-cell therapy for relapsed or high-risk leukemia. So this is one of the latest treatments available. But the type of treatment and whether do we use a combination of all or just chemotherapy alone will depend on the type of cancer and the stage and the risk of cancer. But it is definitely a multidisciplinary team effort. So we work together as a team, together with the surgeons, the radiation doctors, the transplant team, as well as the parents, okay, the nurses, the pharmacists, the social workers, also the school and the families. So it is a team effort in treating children with cancer. There are different types of side effects. So there are short-term side effects or side effects that the child may experience while they are getting treatment. They may have changes in appearance, so they may lose hair temporarily and the hair may grow back. So the hair thing is a big deal for especially teenage girls or girls. For boys, they don't really care. but it is more sensitive in girls. They may lose weight, so their appearance change. For some girls, it is important. They may have fatigue, so some days are good days, they're very active, but other days they want to be left alone and they want to rest. They may have nausea and vomiting, but we have many different kinds of nausea and vomiting medications available that are at the expense of the child, so we can give them. And nausea and vomiting is a side effect, but we can and we are able to control it with different medications and support. They will have low immunity, so they are at very high risk for infections, usually within themselves, the bacteria, the normal bacteria that we have from our body, but they can also have exposure to infections like flu, gastroenteritis, things like that from our families to the child who is getting treatment. They may have unexpected hospital admissions. So this is definitely a horrible thing, especially for teenagers, because they hate being in the hospital. They may have hearing or vision changes, and you heard Kai-Wen. So you might have mood swings, mood changes, and behavior changes. It is not uncommon for a child to regress into their younger days, and they may become more clingy, more wanting to be next to the parent or caregiver when they're undergoing treatment. We have to be understanding and supportive of it, because they didn't choose to have to go through these treatments, but we have to do these treatments because we can cure them of their cancer. Okay, so they also experience late effects. I shared with you that many of the children are going to be survivors for many years ahead of them. So we have to take into account and monitor and pay attention to possible late effects. And the treatments that we plan for also have to pay attention to what are the later effects that these children later on, when they become adults, may experience. So these can occur either within months or years after completing treatment, all the treatments. And there are many different types. So they may have hormone or growth problems. So if they had radiation to their brain or the spine, maybe they might be a little bit shorter than a child who didn't get radiation to the spine. If they had radiation to the brain, if they are older, they can still go through regular university and school, but maybe they just need a few minutes longer to process compared to their peers. Okay, but they will do well, and they can go through normal university, college, normal life later on as adults. They may have fertility concerns. And I think as technology progresses, this becomes less and less of a problem, because even for young girls, we are able to preserve ovaries for later on as young women become into their reproductive age. So we have to think about all of these and plan ahead. And all these late side effects can include emotional late side effects. It can also be physical, and there may also be some social issues. So in summary, I want you to remember that cancer in children is different from cancer in adults. The cause of cancer in children is still not known. It is not like adults, where the lifestyle choices that we do don't really play a role for cancer in children. The genetic or inherited form of cancer is very rare. It's only less than 2%. And that we have many survivors, and these survivors are going to have many years of life ahead of them. And always remember that you are not alone when you are diagnosed with cancer. I think this is my last slide, and I hope that I helped share with you some hope and some positive thinking about when a child has been diagnosed with cancer. I will hand back to Daphne right now.
Thank you, Dr. Ang. And we will have our Q&A session now. So if you have any questions, please put them in the comment section and we can address them. So I think to start the ball rolling, maybe I will ask one of my own question. Dr. Ang, so how do you think we should talk about cancer with our children?
Yeah, I think it's a very, very good question, and it is not so easy because children are developing differently at different ages and different stages of life. So if you have a teenager, they are very internet savvy. They just Google. They have Dr. Google and they have friends. So I think for teenagers, it is always extremely important to be completely honest. So if they ask a question, be honest with them, because they can always find out that if we are not honest, and they will lose trust in us. If you have a child who is age 2, they may not really understand. So you have to kind of explain in simpler terms. They might not even understand what is cancer. They may, some of my parents will say, we are going to give you medicine to make you stronger, to help fight this growth or abnormal thing that is growing in your tummy, for example, to get rid of it. So it depends on the age of each child.
Yeah, I agree. I think at every age, our ability to understand is different. So it depends on which age the child is at and how we'll communicate well with them.
Would it be okay if I ask Jessie if she could share how did she share with Kai-Wen when he was older?
Jessie, I'm not sure if
she went offline.
Maybe I think she did.
Okay.
Yeah, but I think it'd be good to know also. Okay. Okay, how about another question? What is the chance of the cancer relapsing in the later ages? I think you also mentioned briefly just now. So maybe just recap, and also if are there any specific signs or symptoms of a cancer relapse?
Okay, so the relapse rate is different depending on the type of cancer. So if you take the most common cancer, which is ALL or acute leukemia, there are 3 different types. There is a standard risk, intermediate risk, and high risk. Okay, so standard risk and intermediate risk, we can actually cure up to 98%. So meaning that we look at the numbers up to diagnosis to 5 years on. If there is no relapse of the leukemia up to 5 years, we consider the child cured from the cancer. And the relapse beyond 5 years is not 0, but it's very, very low. Okay. If you have a high-risk leukemia, so if you have leukemia as an infant, or if you have a leukemia as a teenager, and there are certain genetic markers in the leukemia cells, you are considered high risk. The relapse risk is higher between the time you diagnose up to the 2 years of diagnosis. For high-risk leukemia, the cure rate is about, I would say, up to 50 to 60%. So which means that you will have 40 to 50% of children who can have the leukemia come back, especially within the first 2 years, but up to the 5 years. If you don't have any relapse beyond 5 years, we start to consider the child cured from the cancer. Okay, so if you have, for example, a brain tumor called medulloblastoma, which is a very common brain cancer, the chance for cure is 80%. So you actually can cure many children. and we don't have risk of relapse beyond 5 years.
Okay.
In terms of signs and symptoms, they are going to be pretty similar to the way that the child initially presented. So for leukemia, it can be, bruising, bleeding, pale-looking child. Same thing. When the leukemia relapses, it may be similar symptoms.
Okay. So to the audience, if you have any questions, do put them in the comment section. Okay, to continue on, how about, I think you mentioned previously that it might affect the child's ability to be fertile after when they grow older. So would the family need to speak with a fertility specialist before the cancer treatment begins?
Yeah, so usually I bring up the topic with the parents because for cancer in children, I aim to cure them because many children are cured from cancer. So talking about fertility is one of the topics that I always include because I cannot reverse the time. Depending on the type of cancer and the type of drugs and the treatment that we are going to use, as well as whether the child is in puberty or not, will play a risk for infertility. Okay? There is always a chance that the child may be able to have their own children naturally without any preservation or any technology support. But in case, there is a risk of infertility, I cannot reverse. So usually I will bring up that your child is going to be cured. There is a risk that he or she may not be able to have their own child when they get married, when they have a partner in future. And I think that we should think about this. So for our boys, right? I don't know if I'm allowed to talk about it on the internet. For boys, when they are older, it's easier. Okay, but when they are young, they don't understand and they are not able to do the necessary things for sperm banking. But for girls, actually, it is a surgical technique. So we do ovary preservation, and it is actually approved by the Ministry of Health for medical reasons. So I do offer, together with our pediatric surgeon, ovary preservation for almost all my young children. Some parents take up, some parents don't take up in terms of ovary preservation, but I am glad that our ministry has approved this for medical reason.
Yeah, I hope the audience will also take note of this as well. Okay, so next question. How will cancer treatment affect the child's daily life? I think you also mentioned that they will lose their hair, they will be fatigued, but will they be able to continue going to school and perform his usual activities? And can they play around with others even during the cancer treatment stage?
Yeah, I always try to encourage the parents as well as the child to maintain a normalcy, because it is an interruption for the diagnosis part for the few months or up to 1 year. After that, they are going to return back to normal. So I think it's important to keep normalcy. So maintain a normal routine. Morning, get up, brush teeth, shower, make your bed, eat breakfast. On the day that you have to come to the clinic or the hospital, go to that. And then after that, eat dinner together, maintain normalcy. If they misbehave, discipline the same way as the healthy sibling. Don't show favoritism. Okay, it's extremely hard because our heart hurts. And we want to always give in when we see our child who doesn't have hair, who have to go through all the different treatments and all the painful procedures. But I think it's important to maintain a normal life, normalcy. Our schools are very supportive. So there are some children who still want to go to lessons. Of course, right now with COVID, it's online, but before COVID, they still want to go to class. So if they have a good day and they want to go to class, let them go to class. And then there are some kids who prefer just to be happily playing on their handphone, right? So they can do that. And then the school sometimes send homework to catch up, or they allow the children to repeat the year or take the exams, depending on what the child and the parent wants.
I think also to build on that, maybe you can share maybe what can parents and teachers alike do to help encourage the children who are undergoing treatment, or like what can they say to their peers and siblings regarding this?
Yeah, it's very age dependent, but I know for older kids and teenagers, their friends are super important. So if when the teacher comes and visits them in the hospital on the day that they're getting chemo, or if their schoolmates come by after school, that is the best day that this teenager has. Okay? They won't talk to me, they won't talk to the nurses, but when their friends and the teacher comes, it's the best day that they come out of their shell. So it also applies for younger kids like age 7 and 8. They're also extremely happy. So I think it's to be open, keep the communication lines open with the school and the friends, let them visit if the child wants them to visit. It really makes their day. Some kids want to be left alone, and I think that's okay as well. When they are ready, they will tell you.
Yeah, I think social interactions are important as well for the child.
Yeah.
Okay, and how would we take care of the nutrition and diet of a child who's undergoing treatment? So, like, are there some foods that they should avoid? Some other additional vitamins or supplements that they should take?
Yeah, I think I'm a little bit more liberal in terms of nutrition. Some of my friends and my colleagues who are pediatric oncologists may have difference in opinion. But for me, because chemotherapy changes their taste and they have bad days where they don't have any appetite, when they have a good day, if they want to have McDonald's fries, or sorry if I'm not allowed to say, some fries or fast food, I allow it because that's the only day that they want to eat. I don't usually restrict whether it's healthy or unhealthy food. It is as long as it's clean, freshly cooked, freshly prepared, no leftovers. I allow them to have anything that they want on the day that they want, because there are many days when they really don't feel like eating anything. It's more that after the treatment is completed, then we start talking about nutritious meals, healthy food, don't drink soda, things like that. But during the treatment, whatever they want, as long as it's cooked, cleaned, well prepared, no leftover, I permit. So I permit junk food as well.
I think children will be happy to hear that. And do one last question. Should we consider clinical trial for children with cancer? I think.
Yeah, I think that all the standard treatments, so-called standard treatments that we have available now, started from clinical trials. Okay, so clinical trials do not mean that we are testing kids as guinea pigs or we're testing adults as guinea pigs. Actually, all these trials have been tested in the lab, and then they are tested in different phases of clinical trials. So you have phase 1, 2, 3, and 4. Most of the clinical trials in children are going to be in phase 3 and 4, which are looking at numbers, and we already know that it's effective and safe. So I do encourage families to participate in clinical trials whenever it's available. I think it's important to help the field of pediatric oncology progress and for us to be able to cure more and more kids as time progresses.
Great, thank you. Okay, I think we don't have any other further questions. Do you have anything to add, Dr. Ang?
I'd like to thank you for giving me this opportunity, and also want to thank Jessie for sharing her story and her feeling of wanting to encourage and be positive for everybody else. So thank you so much for this opportunity as well.
Yeah, thank you, Dr. Ang, for your sharing. Thank you.
Thank you.
Okay, we are coming to the end of our session now. We'll just share some updates on our next event for the Health Talk. So our next Facebook Live event is on the 15th of May, and the speaker is Professor Lim Ka-ming. He is our 365 CPS Executive Committee member as well, and he will be speaking on the epigenetic mechanism of blood cancers. So this topic will be conducted in Mandarin, and we hope to see you on 15th of May. So this is our social media websites. So as this talk is also co-organized by Icon Cancer Center, so please like both of our Facebook and Instagram. And we are also on Telegram, so if you type in this link, you can also subscribe to our Telegram channel. So we have come to the end of our Facebook Live talk, and I hope that it was a good and informative session for all of you. Thank you once again for joining us, and we hope to see you again next month. So have a good evening and have a good weekend. Thank you. Bye-bye.